Thank you. I'd just welcome everybody today. We're going to give you a brief presentation about the NIHR ARC studentships program that's coming. And in the College of Social Science, what we've got is agreement that we can support up to 4 of these over the forthcoming years. So this is really to give you information about the system and how it works. I'm going to introduce Emma Rowley, who's from NIHR. She's going to talk about her program, and then we can ask questions and all that kind of stuff afterwards. Thank you very much.
Hello everybody, so I'm going to be talking about the ARC PhD program that we're offering across the East Midlands. The funding call will be coming out early in 2022. As you just heard, Lincoln has agreed to co-fund some of these studentships, and so some inside tips are going to be offered now to put you in the best possible situation really for the call to come out. So this is a quick overview of what I wanted to talk about today, and we'll just cover some of those in the next few minutes and a few slides. So for those of you who don't know about ARCs, ARCs are funded by the NIHR as applied research collaborations. From 2008 to 2019 were referred to as clerks, and in the room today we've got several of our PhD students who have done this funding programme before now. So the clerks, and lastly the ARCs, are local collaborations between health, social care, local authorities and higher education institutes who conduct applied research that focuses on the implementation of evidence into practice and closes what we refer to as the second translational gap. We also have to work in partnership with our AHSMs, or the Academic Health Science Networks. There are 15 ARCs across England at the moment, as the map shows. In the East Midlands, we probably cover one of the biggest footprints of about a 5 million population. So these are some of the examples of our current ARC portfolio of main studies. These aren't our PhD studies, but our main funded trials. And those highlighted in yellow are the studies that are currently running out of Lincoln or recently concluded in Lincoln. So we work with EMAS to evaluate the High Potion Strike Twice booklet, which has recently been rolled out for national adoption. There's currently a study looking at ambulance calls to care homes being led by Warden. And very, very recently, we've just funded a systematic review by David Nelson to conduct ambulance call-outs for mental health issues and comparing rural and urban locations. So all of our ARC work, including our PhDs, has to fit into 6 funded areas. These are on the screen now, so multi-morbidity, mental health and wellbeing, community resilience and enabling independence, so stroke, frailty, falls, that kind of thing. Data to health, which is big data, ethnicities and health inequalities, and translating and implementing sustainable service improvements is also known as our implementation science theme. It's incredibly easy to fit any programme of work into the ARC themes. I've been doing this job since 2009 and only ever failed once. So my word of advice is, please do not do a cancer-related study because we will not fund that. So as part of our research, we have to get these into practice, and apologies to all our academic colleagues, academic research outputs don't translate into practice very easily, if not at all. So we have to do some kind of jiggery pokery or some magic to get that evidence into a form that's going to be usable and acceptable to practice. And on screen are just some of the things that we can do. So we have implementation toolkits or booklets, infographics, and naturally we've done a lot of animations as well to get public health messages across. So looking specifically at our PhD programme, one of the ARC's main KPIs is about building capacity and capability to undertake and utilise health evidence for the benefit of patients. And that's not just for clinical academics, so nurses, midwives, AHPs who want to undertake research and link it to their practice, but also for more traditional researchers. So it's about building those skills, but making sure that what those skills do is deliver practice and impact. So to do a PhD with ARC, the clerk can work. Our legacy portfolio catalogue of students, we've done with about 50 PhD students which were in the ARC programmes from 2000 onwards, and to date 27 of those have been awarded. And in our present ARC licence, we said we were funding 40 PhD students. We've currently got about 33 on the books. It's a bit tenuous sometimes with maths about how people suspended and have they not registered yet. But so our current cohort of legacy and current PhD students was just about 50 that were still kind of having some pastoral support and keeping an eye on and making sure they're So just some quick slides about where our students are, who they are, where they come from. So we currently fund PhDs across 6 of our 7 regional HEI institutions. We fund them across our art themes. Our students have a range of different occupational backgrounds, traditional academic researchers, but then also nurses, midwives, AHPs. Our PhDs don't tend to be attractive to doctors or dentists, possibly not some other practitioners, maybe we'll come to discuss that later. And it also shows you what kind of health organisation our PhDs are linked to. As I said, we will fund practically anything in terms of an applied piece of research, as long as it's not cancer. These are just some of the thematic areas of work that our students have worked on. It can be about pre-prescribed, it can be about frailty, it can be about acquired brain injury and trauma, COPD, men who take prophylactics, gestational diabetes, dementia, you name it, we've kind of basically funded it in the past. We're also really proud to have our legacy successes of our PhD students, and some of the stuff our PhDs have done has been absolutely amazing. So I guess one of the biggest impacts we've had on the PhD program is national mandate through NHS England of first point physiotherapy contact. Our PhD students will sit on and continue to sit on government advisory panels. We have a huge success rate in getting people postdoctoral fellowships. All of our PhD alumni have developed their careers in ways that wouldn't have been possible had they not done a PhD. And several of them have gone on to secure prestigious NHR fellowships. So it's really important to try and convince people as to why you should invest in a PhD yourself, or why your employing organisation or your host education institution should invest in a PhD. And for us, it's about making sure there are local evidence-based solutions to local key issues in practice. It's about research that will immediately benefit and so I have direct benefit and direct links to patients or service users or whoever that target population is. From an organisational perspective, it's about investing in culture and capacity, it's about reputation and growth, and at the bottom line, it's about the development of income potential, because PhD students, as they develop through this pathway, will always bring money back into your own institution. But we also ask people to be really realistic about why they want to do a PhD. So a PhD will not by default lead to implementation of evidence into practice. It also, any change that results from a PhD won't be quick, or possibly even won't be visible. So here we have 4 of our PhD and postdoc students at the moment talking about their pathways into research. And this was part of a national campaign from the NHR that we recently. So Marie, who we've got in the room with us today, is probably carrying on her desk in embarrassment. Sam, who's one of our alumni PhDs, postdocs, has now gone on to national NHR clinical lectureship. Lynn, an advanced nurse practitioner who's just started her PhD down in Leicester, and now who's got a prestigious BIS fellowship to do her PhD. So also, the people in the room will see themselves, these are the students that we have or will have in the past supported through Lincoln. So Marie, Rebecca, Becky and Greg. So the important bit is our funding offer. So we don't know what our funding offer is going to be for 2022 yet. It's something that's going to happen probably in the next 4 to 6 weeks. We'll be able to confirm it. In the past, in the last few years, our funding model has been on a 50% funded basis. So a PhD costs approximately £62,500 bare minimum at the moment. And that covers university fees and stipend payments. They are basic stipends, they are tax-free, they're not a salary that's commensurate with practice. They also, that £62,500 does not cover any research costs, any equipment costs. The art money will come with no organisational overheads too. So what we've done in the past is fund £30,000 towards this £62,500 and ask for the other £32,500 plus to come from different partners. That might be the academic institution itself, it might be from NHS or social care, it could be a combination of those, it could come from charity funding. It's about piecing it together to form a jigsaw to then have the costs come forward. So how that £62,500 has been reached in the past has been entirely bespoke based on everybody's different applications and their and I'd welcome conversations with people who show interest in the funding. If we decide how we're going to fund, come and talk to me, because it's not easy to piece it together, and we can be quite creative in how we do that sometimes. Our call will be an open competitive award. It's likely to be made in late January, probably early February. We will announce it via the ARC website, our Twitter accounts, and our existing emailing lists. They will be competitive. This is NHR money, this is publicly funded money, so our scrutiny panel is for eligibility, then we shortlist for interview, and then we call successful applicants forward to interview panel. It's normally a professorial panel of about 4 or 5 people, and it can be quite tough and quite grilling, so you have to, it's great nodding in the background, having lived through it. It's not easy, but if you want to do a PhD, you have to make sure you deserve your funding and you're good enough for it. So as I said earlier, this is about applied, impactful research. Has to be linked to one of our 6 ARC themes that cannot include any mention of cancer. Even if it's just in passing, our ARC portfolio is not funded to do cancer research. And lastly, that university has to be based in the East Midlands, so for Lincoln, absolutely fine. So our process. Please do contact me if you want to apply, work with your supervisors, talk to Ross, but come and ask me, just check that there's no small error that's going to make you ineligible to apply for. It's really important to say the applicant should be the student, not the supervisor. We can always tell when the supervisor has written an application, because the student can never ask the questions that that pesky academic panel are going to ask them. You have to have a confirmed place at your university before you apply. This is prevent us issuing funding and then a university saying, well, actually that person doesn't meet our entry criteria. Supervisors need to be members of our ARC faculty, which is a free to join group, and there are details on the slides about how you can do that one. So there will be an application deadline. Obviously, if applications aren't in by that time, they will not be eligible to be screened for shortlisting. All our applications, once they're confirmed as eligible, will go to a shortlisting panel. Decisions will then be made about whether to issue an invite to interview or not. At the interview panel, a short presentation will be made. We normally do some person, place and project, the same way as the NHR do, and then usually have normal interview question and answers. All of our applicants will receive feedback based on their applications and feedback from the interview or shortlisting panels. And then if successful, we will work with that person to make sure the funding is transferred to their university in time for them to commence their studies. And luckily, all students will have an ARC induction normally in the autumn of the semester that they register in. So here's just some things about what our application covers, and these slides can be shared later, so we don't need to go through those. Don't leave an application to the last minute. Would be my advice, definitely. So some benefits about why would you want ARC funding? Because actually there's lots of PhD funding that can be applied for. ARC funding is a little bit different. So it's not NIHR fellowship money, which comes with full salaries, but to get one of those you probably want to be spending at least 12 months writing an application for it. I guess there's a bit of added value that comes from ARC. You are part of NHR infrastructure, and so you can access all the different NHR training systems. There are particular funding streams that you can apply for add-on events, such as the Spark Awards, Spark local authorities who want to go and do a placement in a local authority or a different research institution, or the Vista Awards if you wanted to go and deliver a seminar at a different university. All of our students are eligible to apply for a travel dissemination prize. We can support them under their PPIE costs. We also have a huge group of PhD cohort that we can offer mentoring to, ARC support. Possibly this year we'll have an online peer forum for our PhD students to use as well. And all of our students get access to our training courses, which we normally do sessions that universities wouldn't traditionally supply. So later this week we've got a team of journalists coming in for it as an example, to deliver a clear writing course for academics. So some of our expectations and requirements from our PhD students. We want impactful research. We ask for regular updates just to make sure that you're okay, or if there are any changes that we need to be aware of, and to help manage some of those risks. So we do this by quarterly updates, which should take you 5 minutes, possibly. I don't think they're overly onerous. We ask for NHR disclaimers to go on all presentations and publications, regardless of their work in the stuff we funded you for. We have funded you as individuals rather than the work. And we do that exactly the same for all the profs we fund as well. We ask you to adhere to NHR corporate identity rules, which again we will support you with. We have to report every single output that you publish that goes back to the NHR each year. We need your audit numbers. Sadly, we now require you all to do research fish submissions. So most academics have had NHR funding, we've grown at the thought of that, but now students need to do this as well. We have summaries about your work on our web pages, and we ask those to be regularly updated. And we've also started collecting progression and EDI demographic data to show the impact our research has, but also where we need to work harder to kind of in-reach into areas that maybe haven't had that investment before long. So that's a really quick whistle-toss tour throughout our programme, and I hope it's an attractive offer, and we look forward to any applications that come from Lincoln.
Okay, can I thank you very much for that. I'm not sure if we have any questions or not. Do we have any questions? I don't think there is any on the chat, I can see. So if that's the case, I guess probably, perhaps we can, did they want to share their experience of art? Anybody willing to? We have 2 or 3 people who have had the art fellowships before. Come to the front and
Hello, my name is Whitley. I had a NIHR studentship from 2018 to 2020, and I am a paramedic, and my research was on the field of pain management in children. And the ARC funding allowed me to do the PhD full-time, whilst also working clinically part-time. So I worked 1 week per month for the 3-year period, and the combination of the ARC funding with the part-time salary was enough to supplement my income to a reasonable amount. So yeah, without the funding, obviously I wouldn't have been able to complete the PhD. So it's very worthwhile applying.
of course you're now academic.
Yes, so I'm now a lecturer in paramedic science, and the ambulance service has created a new position for me. So I'm a paramedic research fellow with the ambulance service, and I've recently been awarded a postdoctoral bridging award. So I'm looking to design and submit a full NIHR fellowship for the clinical lectureship, and I'll be looking to apply in June next year.
Thanks very much, Greg.
Hi. So my name is Warden. I'm funded by the ARC to do my PhD. What it's allowed me to do, so my background is in nursing. I'm from Child Adolescent Mental Health Services originally. The PhD funding allowed me to run a randomised controlled trial looking at how we can help young people with body image disturbance. So it's been a fantastic opportunity to try and move practice forward while helping the young people that we're here for as well. So it's well worth doing.
Thank you very much.
Hi, I'm Becky Goddard, and I'm just in my first year, just coming up to the end of my first year with NIHR, and again, the funding that I received has allowed me to conduct my PhD full time. My background is social work, and I'm looking into experiences and service responses to domestic violence in rural Lincolnshire, so hopefully we'll generate some really deep insightful results about how rurality shapes the experience of domestic violence for people living in those contexts. And I think as well the support that you receive, the training and everything really goes to enhance the experience, and even the quarterly reports sort of make you focus and keep a track of where you are and where you're progressing and how your PhD is moving forward. So yeah, it's a really positive experience.
Thanks very much. So I guess the point that we're trying to say is to think about what might be an area of interest, think about how you can shape that up for a question that would fit within the ARC remit, and find yourself a supervisor to discuss about where that might go in the long term, and look forward to seeing all these new students in the future, possibly. Okay, thanks very much.